One of the fundamental concepts of osteopathy in general is that everything is interrelated. It is the ultimate in holistic medicine. It therefore follows that visceral osteopathy is going to understand that there is a definite relationship between the visceral organs and the spine. The spine innervates the body, not just the muscles in order to be able to move, but also the organs in order to be able to function. And this phenomenon contains two basic principles that are important for you to learn from the beginning. They are the visceral-somatic effect that occurs when there's visceral dysfunction that affects the spine, and the somato-visceral effect that occurs when dysfunctions of the spine affect the viscera. So what we have is basically an effect that can go in both directions. And we use two separate terms when we're referring to whether the viscera are affecting the somatic or whether the somatic is affecting the viscera. Although you might see people using just one simple term to refer to that interrelationship. In clinical terms, this phenomenon really displays itself in cases where patients who are suffering from internal organ disease will respond very quickly and dramatically to therapies that are delivered through their corresponding somatic structures. A classic example of that is chiropractic or spinal manipulation, whereby if a specific region of the spine is treated, that a digestive issue might resolve itself immediately. Some of the most classic examples that I can think of is when I tell mothers that many of their constipated children who've been brought to me, and I'm talking about newborns, often their constipation is resolved after even just one session with me. Why is that? Because very often constipation in a newborn child is related to some type of dysfunction within the lumbar or pelvic area, whether it be spinal, whether it be a myofascial torsion that's contributing to spinal problems, whether that is a sacrum that is misaligned or stuck, so to speak. Whenever I've treated a child who came to me with constipation and who had somatic dysfunction within the lower lumbar spine or pelvic or sacral area, after one treatment, they always had bowel movements. Another example is you might have someone who's feeling a little bit nauseous in their upper GI tract, acid indigestion, the food won't go down. And you do a structural manipulation of the corresponding areas of the spine, and the person will say, oh, okay, I feel better. Yes, that pressure has been relieved. Those are examples of how treating the spine, treating the somatic area, can have an effect on the viscera. Let me give you some quick examples of how the viscera can affect the lumbar spine that I've often seen in my practice. I remember a patient coming to me who had a history of IBS. She had certain digestive sensitivities, and when she finally eliminated those digestive sensitivities through clear instruction and collaboration with a naturopathic doctor, she had managed to free herself of the IBS reactions and spasms. And that was just an aside in her health history. What she came to me for was recurring and chronic low back pain. But when I spoke to her about her history of digestive problems, because when I interview a new patient, I take additional time and I really dig into their history to make sure that I can identify any other concomitant factors that might be contributing to the problem. Sure enough, when I palpated and verified the area of the small intestine and the lower abdomen, I found that there was a lot of rigidity and a lot of adhesions. And when I relieved those adhesions, lo and behold, her back pain disappeared. I did not treat the sacral area or the lumbar spine. My instincts, my spidey senses told me that it was referred pain coming from all that history of inflammation and adhesions in the lower area. Specifically, we know how the small intestines are all piled in there on top of each other, and they are a perfect area for inflammation because of allergic reactions, and therefore adhesions. those are just some classic examples, but they're already starting to prepare you to think about some clients, even though you might not be ready to actually start doing hands-on work, starting to be able to identify clients in your clinic that might be in need of visceral treatment, where visceral treatment might be indicated because of that somatovisceral or visceral-somatic effect is an important start for you. So the somatovisceral reflexes are an example basically of how the neurological system interrelates with the digestive system. Now the viscera and that visceral effect is a concept that's much discussed among osteopaths. It's not new to me or to this course, and in fact either as well within other forms of manual therapy, chiropractors know very well the various segments of the spine and how they interrelate with each digestive organ. So since there's a definite relationship between the viscera and the spine, and this reciprocal relationship is why it's called visceral-somatic or somatic-visceral, meaning that one can affect the other. Simply put, whatever is going to happen within the organs or the entire visceral system within the body can have a reflex effect on the somatic area or on the corresponding spine or nervous system of a patient. And similarly, any type of dysfunction that's going on within the spine, whether it be hypertonia or hypotonia or facilitated segments of the spine, that somatic effect can have an effect on the viscera. Think of a person who is paralyzed from the waist down. Very often they can lose function of the bladder. And we know that there are exact segments of the lumbar and thoracolumbar junction area that control the reflex of the bladder. Therefore, if we either augment, or we call it hyperfacilitation, activate the nervous effect of the nerves in that area of the spine, we can also turn up the intensity and volume of the activity of that organ. Similarly,